In chronic diseases, Dr. Hahnemann has said, but still, even in such favorable external relations, as soon as these persons advance in age, even moderate, now, favorable condition may be agar if patient is sitting, because the neocortex is being hijacked, in favorable, see the same language Dr. Hahnemann is saying, nothing out of chronic diseases organism. What Dr. Hahnemann is saying, that in favorable conditions also, when the patient is in favorable conditions, in advanced age also, when he is grown up also, a slight vexation, cold, error in diet, etc., can produce a violent attack of, however, only a brief disease. A violent attack of colic can be produced, inflammation of the chest can be produced, or the throat erysipelas, fever, and the like. And the violence of these attacks seems to be out of proportion to the moderate cause. Cause itna nahi hoga, but the reaction becomes moderate because cortex is shut down. Amygdala and the last brain is working, right? So the cause, he has clearly mentioned, the cause is not much. We will see that the patient is reacting to such a minor cause. But why? Because the pre-programmed brain is already in alert. I'd seen a movie I would like to share for a light note in between the heavy slides. I have seen a movie in which there was a heroine, Tapsi Pannu. Her husband slapped her, and the whole movie was on that. And that slap was in an impulse. That was not because of purposely. It was not purposely. Most of you must have seen. I forgot the name of the movie. What was it? I forgot it. Maybe you must be knowing, and you must have seen also. The guy who was Tapsi Pannu's husband drank, and in an impulse, he threw her at the back, and usi mein thappad lag gaya, slap lag gaya. And the whole movie was in that. She reacted in such a big manner to that single slap that the boy said sorry also. He went to, he said that I will not do it again, but she was not pacified. So this is what Dr. Hahnemann is saying. To a very moderate cause, the reaction of the patient is very big. Why? Because तापसी पन्नू के सबकॉन्शियस में कहीं ना कहीं वो पहले ही रजिस्टर होगा. Primitive brain was already pre-programmed, maybe from her mother, maybe from her nanny, or maybe from somebody else in the parental background, because Psora has traveled from generation to generation. In Tapsi Pannu, it has come, and that was why the reaction was so big. Right? So maybe I'm able to deliver my point. Moving on, under stress. Now we are talking of stress. When the patient is in a stress condition or anxiety, or presumably even the intense excitement of joy, even in joy also, a nerve running, there is a pathophysiology behind. There is a nerve in the brain, amygdala gets alert that something is wrong. When amygdala gets alert, the signal goes from amygdala to hypothalamus. Hypothalamus gets alert, and hypothalamus creates a stress condition. No, something is wrong. For example, somebody has entered the home. Hypothalamus will release corticotropic releasing hormones. When it will release, they will go to adrenalines and adrenal glands. And adrenal glands in response will release norepinephrine and epinephrine. Those will create in the body, they will create fight and flight response. Now, what is flight and flight response? Everybody must be knowing. Aapka mind disturb hua and your body gets in fight and flight. Sympathetic nervous system gets active. Fight and flight means you get alert. What do hypothalamus do? It amygdala ne bola fear hai, panic की situation create की, amygdala alerted hypothalamus, सब mid brain का काम है. Everything is going in the mid brain. हाइपोथैलेमस ने पिट्यूटरी को अलर्ट किया, पिट्यूटरी ने एड्रिनल ग्लैंड्स को, वहां से एपिनेफ्रिन नॉन एपिनेफ्रिन रिलीज हुए एंड फाइट एंड फ्लाइट रिस्पॉन्स गेट्स एक्टिव। फाइट एंड फ्लाइट रिस्पॉन्स में क्या होगा, वही सिचुएशन जब आप क्राइसिस में है। सपोज यू आर रनिंग एंड somebody is behind you to catch you. Suppose there are robbers behind you, या स्नेक देख लिया आपने, तो क्या होगा, your heartbeat gets fast, there is blushing on your face, right? Your appetite centers get closed, your breathing gets fast, your muscles get active because you have to run, all the focus becomes to the locomotory system, right? और ये किसका रिस्पॉन्स है, बैक ब्रेन का, प्रिमिटिव ब्रेन का, रन, फाइट और फ्लाइट। Your body, non-epinephrine and epinephrine, what will it do? It will do glycogenolysis. It will break the glucose and gluconeogenesis. It will make more glucose because to give you energy. Your thinking brain, your rational brain will shut down. Okay? Agar aap, if you are going through a long way, you are running. If your neocortex is working, you will say, how will I escape? Should I go from this route? The robbers will not follow me here. Or there is a car coming, should I take a lift? No, because your rational brain is not working. What is working? Primitive brain, fight or flight, bhago, right? So these are the condition when hypothalamus, amygdala is an alert. पीछे क्या cause है, amygdala, और amygdala को किसने alert किया, something which is Psora. क्या किसने alert किया, Psora ने, और वो Psora पहले ही pre-programmed है in your brain. So in diabetes what happens is glucose बनी जा रहा है, right? But बन रहा है, why? क्यों बन रहा है? Now the cause is clear, right? Insulin inhibit हो रही है, glucose in the blood is increasing. Why is it increasing? Because amygdala is an alert, because there is a stress going on behind, because the back brain is working. Am I clear with the point? This is called hypothalamus pituitary adrenaline axis. This is in this slide. I will go through this. Under stress, in anxiety or in excitement or in joy, a nerve running from the brain to the adrenaline gland atop the kidneys trigger a secretion of the hormones epinephrine and non-epinephrine, which surge through the body, priming it for an emergency. These hormones activate the receptors on the vagus nerve. While the vagus nerve carries the messages from brain to the heart, it also carries the messages back to the brain, triggered by epinephrine and non-epinephrine. The amygdala is the main site in the brain where these signals go. Sabka, I would say, usually I say amygdala is the root cause. Punjabi mein hum bolte hain pasudi pan wala. It is the main cause of all the problems, right? They activate the neurons within the amygdala to signal other brain regions to strengthen the memory of what is going on. Amygdala create karta hai, and hippocampus में जो memory है, it goes on strengthening and strengthening. Yes, this is firm. Yes, this is firm. And the circuits are making more circuits are going on, right? If, however, insanity or mania, now this is in aphorism, I forgot to write the number. Aphorism, what Dr. Hahnemann is saying, जो अभी मैंने पढ़ाया in Dr. Hahnemann's language, in Organon of Medicine's language, what he is saying to these kinds, he says, if, however, insanity or mania, ये हम we will discuss further in the further class. Today we are only discussing about emotional and behavioral disorders. If, however, insanity or mania caused by fright because of fear, vexation, abuse of liquors, etc., have suddenly broke out as an acute disease in patient's calm state. Right? We are linking the first slide to this slide. Whatever we have studied, we are linking back to this slide. What we have studied, a brief summary, what we have studied, that the patient is going on well, suddenly he gets phobias. The patient is going on well, suddenly he is in panic. The patient is going on well, he sees Dadi and suddenly his response comes. The patient is going on well, suddenly she sees her father coming in the home, response comes. Why this happens? This is what is told in this aphorism. We will read it very carefully and I will go very slow with this aphorism. If, however, insanity or manias caused by fright, महारानी आ जाती है because father आया, amygdala ने fright alert कर दी, vexation, anger आ गया father पे, और spirituous liquors, etc., have suddenly broken out as an acute disease in patient's ordinary calm state. Patient was calm and suddenly he became aggressive. Patient was calm and suddenly Maharani came. Patient was calm and suddenly the girl fainted. Although it almost always arises from the internal Psora. This is where I wanted to bring you. This is where all the slides summarizes. I wanted to bring you this, that Dr. Hahnemann is very clearly saying whatever happens at the level of mind, whatever happens at the level of emotions or behaviors is because it always arises from internal Psora, like a flame bursting forth from it. Yet when it occurs in this acute manner, it should not be immediately treated with antisorics. Dr. Hahnemann क्या कह रहे हैं? If a patient comes to you in a calm state, you have to search for Psora. But if the patient is in a state, जैसे महारानी की state में patient आ गई, in which the patient is very aggressive, the patient is not listening to you, you have to first bring him down. For bringing him down, you do not have to go to antisorics, but you can give a medicine on the present state which will bring him down, right? But in the first place, with the remedies indicated for it out of the order class of proved medicaments, example Acute, belladonna, stramonium, hyoscyamus, mercury, ये जो main medicines हैं, which are for this, because now we are treating for the symptoms, we are not treating for the Psora, क्योंकि patient अभी in present he is in a state of exhilaration, he is in a state of aggression. So first we have to bring him down. First we have to bring him at a pace of talking. So we can give medicines out of this on the leading symptom. कैसा उसमें mania है, कैसा insanity है, उस पर दे दो. But if we are giving it regularly on this is wrong. This is also talked in the next aphorism. First I will read this. Acute belladonna in highly potentized minute doses in order to subdue it so far that the Psora shall for the time revert to the former latent state wherein the patient appears as if quite well. उन्होंने लिखा है appears quite well. हमें लगेगा हमने belladonna दे दी, settle हो गया, patient is in a well state, right? So this is a condition when a patient comes to you in a aggressive mood. For example, मेरे पास वीडियो भी होगी of a patient, शायद हो, of a patient, थोड़े दिन पहले a patient came. He is a boy, he's studying in Agriculture University, Ludhiana, near us. Very intelligent, very obedient, very conscientious child, only son, he is having a sister, and from a very lower to middle class family, जिसमें father के पास does not have much money. He came to us in a very aggressive state. Aake, he's banging on the table. He's fighting with us. He's saying, "Give me 1 crore rupees. Treat me or I will go." He says, I have direct talks with the Prime Minister. I can call him and he will pick you up. He's saying to us, he will pick you up. Give me proper medicine. You are not giving me proper medicine. He was about to attack us. So you tell me whether he's in a condition to talk or not. I think no. Will he be listening to us? No. ये भी aphorisms में Dr. Hahnemann ने बताया, अगली क्लास में लेंगे, right? So he was not in a condition to talk. This is what he is saying, that suddenly broken out as an acute disease in patient's ordinary calm state, right? So ये broke up है. We have to bring him down first, right? So for bringing him down, see, if you are getting hold of Psora, prescribe on Psora. But if you are not getting holding of Psora, you have to bring him down first. give him on the leading medicines, leading symptoms. ठीक है, तो उस पे ये medicines देकर वापस वो normal state पर आ जाएगा. पर do remember, these medicines are not for cure. These are only for palliation. What allopathy does. जो एलोपैथी कर रही है वही सेम हम अपनी मेडिसिन से उसको ब्रिंगिंग डाउन कर रहे हैं. दिस इज नॉट क्योर बिकॉज वी आर नॉट गेटिंग होल्ड ऑफ अमिगडाला. वी आर ओनली गेटिंग होल्ड ऑफ द रिएक्शंस. वी आर नॉट गेटिंग होल्डिंग ऑफ द कॉज. नेक्स्ट, aphorism 222. But such a patient, continuity है, but such a patient who has recovered from an acute mental or emotional disease by the use of these non-antisoric medicine should never be regarded as cured. Dr. Hahnemann has totally said this in a very clear language that this is not cure. On the contrary, no time should be lost in attempting to free him completely by means of a prolonged antisoric treatment. He says you should not waste time. You should immediately prescribe him antisoric from the chronic miasm of Psora, because there is Psora behind. If you will not prescribe him antisoric, he will get another attack. You will again give belladonna, he will get another attack, and the period of attacks will become shorter, shorter and shorter. Right? First अगर अटैक महीने बाद आता था, 15 दिन बाद, 15 दिन बाद आता था, हफ्ते बाद आता था, 3 दिन बाद, and now daily. Why is the period of this thing becoming shorter? Because you have not caught the Psora. You are prescribing on the symptoms. Okay? So Dr. Hahnemann has said that it is not cure. You have to go to the Psora by the means of prolonged antisoric treatment from the chronic miasm of Psora, which it is true has now become once more latent, but is abhi wo latent hai because you have prescribed the medicine on the symptom, but it's quite ready to break out anew. It will break out. If this be done, there is no fear of another similar attack. If we do so, no similar attack will come. If he attended faithfully to the diet and regimen prescribed for him, if he has taken our medicine very properly, no further attack will come. If you will treat the back brain, if you will treat the subconscious mind, if you will get hold of the Psora.